So it's within our power to get this under control, and that is to get vaccinated.
Dr. Anthony Fauci warning tonight that if we don't get the virus under control, we could be months away from a return to normal thanks to the Delta variant and lagging vaccination rates. Joining us now to talk more about this, Dr. Stephen Valassis. He's the chair of emergency medicine at St. Vincent's Medical Center. Doctor, good to see you again. Thanks for joining us.
Good evening, Rich. Thanks for having me.
So let's talk about this warning now from the nation's top infectious disease specialist, Dr. Fauci. He warns the COVID-19 crisis will not be under control until spring of 2022 now. Listen to this.
If we can get through this winter and get really the majority, overwhelming majority of the 90 million people who have not been vaccinated, I hope we could start to get some good control in the spring.
So again, doctor, that's spring 2022 now. What's your reaction to that?
Well, Rich, from the beginning, we've been talking about the way for this pandemic to end is to get the herd immunity, whatever that percentage of people who either need to be vaccinated or have protection from getting the virus. And so, the Delta variant changed things for us. It's easier transmissible between people. It's making people sicker. And now as we're, the summer's ending, kids are going back to school and people are going to be indoors again, we're worried about the virus spreading. And what we don't want to see is another mutation that could make it even more severe. So getting people vaccinated is going to be the number one way of ending this pandemic, talking to the people who are not vaccinated to get them vaccinated, and the hopes of having the vaccine for our children so that they can be vaccinated in the near future.
So, doctor, the goal, of course, is to increase the vaccination numbers. But what do you say to someone who says, look, they did it again. They keep moving the goalposts. And so I don't know about this. Are we ever going to get through it? Is it worth the risk that I believe the vaccine comes with the vaccine, so to speak? What do you tell that person?
So I think two things. I think, we're dealing with a new virus. This virus has only been around since the end of 2019. And so we're still learning about it. And there's mutations and changes. And as the science evolves, the information that we gather is being presented to the public. One of my colleagues said, all you have to tell people is to look around. There's hospitals full of patients with COVID. There are patients who are sick throughout the country. There are not hospitals full of people who are vaccinated. There are not hospitals full of people who received the vaccine.
Yeah, it's a good point, doctor. So let me ask you, you've got the variant really causing big problems here in terms of the numbers. How about booster shots? Is that the way to potentially combat this, or are they two separate issues?
No, I think they're one and the same. I think part of the problem we're seeing now is we have both the Delta variant, which is more contagious, and then you have people's immunity that's starting to wane. So we already were giving the next shot to the people who are immunosuppressed, people who either because of their medical problems or medications need an extra shot to help their immune system protect them against the virus. But now what's happening is the studies are showing that somewhere in around 8 or 9 months later, people's immunity is going down. And so getting that booster, making sure that they're protected, especially protected against this Delta variant, is important.
So when we see numbers that suggest that the effectiveness of the vaccines against the Delta variant are decreasing, is that because we are losing the amount of immunity we had from that first series of shots, I guess? Or is it because, the Delta variant is just too difficult for these vaccines to combat, period?
So I think it's a combination of it. I think we probably have some immunity that's waning right about now. And also this Delta variant is more contagious and making people sicker. So, really getting people vaccinated and putting this virus to rest is what we need to do.
Okay, let's talk about vaccine hesitancy within the medical community. We've seen some hospital workers protest vaccine mandates. There's also, of course, been a whole lot of support for the shots as well. How about in South Florida? A group of doctors banded together just today amid a surge in COVID-19 cases among the unvaccinated. As you pointed out, look at what's taking place in the hospitals. The staff at this hospital in Palm Beach Garden says they're exhausted. Their patients and their resources now are running low. Doctor, is this, you think, something we may see more of? Those of you on the front lines having to speak out and say, hey, this is not a myth. Just look at what we're dealing with again.
Yeah, I mean, I think if you speak to any first responder, you speak to any healthcare worker, they'll tell you what's going on and what they're seeing. We all have stories. We've lived through things, and we're living through them again. I think there's some people who are being very loud, but those people who are loud are not the majority. The majority of people in the community, in our health community, we're getting vaccinated. We're protecting ourselves, and we're protecting our communities.
And what about the other side of that conversation? Because there are some medical workers who are out there protesting sometimes in front of their hospitals or their healthcare facilities, saying they don't want to get this shot. How do you kind of combat that in terms of being able to reach the overall community, the public?
Well, it's hard. I mean, I want to support people's decisions, but when talking about the hospital, what we need to do is keep our patients safe and keep ourselves safe. If my loved ones come to the hospital, I want the people taking care of them to be vaccinated, and that's kind of the simplest way to put it.
Doctor, lastly, I want to ask you real quickly about this. You're seeing things online of people looking for alternative treatments. How about ivermectin? You've probably heard of this. The FDA actually tweeting out, "You're not a horse, you're not a cow. Seriously, y'all stop it." That's an actual tweet from a federal agency, because ivermectin is meant for horses and cows. Doctor, again, how do you combat these types of things?
I mean, I think there's a lot of things for me that don't make sense. There's a large body of evidence that's saying that vaccination works, and there's people who are hesitant. And then there's people who are looking for things that are out there that are not proven at all and are asking for it. So I think really we need to step back. We need to look at the science and do what's right for ourselves.
All right, Dr. Stephen Valassis, thank you so much for coming on. Stay safe on the front lines of this battle.
Thank you. Good to see you.
Good to see you as well. Well, there's trouble in paradise. A popular tourist destination is now telling visitors to stay home. Plus, what's next for Moderna and Johnson & Johnson's coronavirus vaccines? That's right after this.